Today I will be addressing a major issue in the United States. As most of you are aware, our health system is flawed. However, a major problem which is often overlooked is the unequal opportunities for healthcare which the poor and non-white minority groups often face. The primary focus of this presentation is to address the issue of unequal health opportunities that exist within our health system currently. The United States has been trying to improve the overall equality for people regardless of race, ethnicity, social class, and gender. Yes, we have made huge strides in the right direction, but one area that is in dire need of reform is the healthcare system. Currently, over half of the uninsured population consists of people of color. This is important because people without medical insurance are statistically at a higher rate for developing multiple chronic health issues. The government and healthcare industry must make this issue a priority. The primary focus needs to be around improving the cost, quality, and access for people of all backgrounds. By improving the quality and access for people of all backgrounds, we can hope for an all-around healthier general population. This chart represents the different percentages of each race that was uninsured in 2017. This tiny blue sliver represents the population of white Americans who are uninsured. This shows that the white population has far more access to health insurance than either of the other three races. Hopefully this provides you all with a visual representation of just how apparent the gap between whites and minority ethnic groups are in regards to equal access to health resources. This inequality and discrimination can lead to serious negative implications. Minority groups are statistically more likely to experience a period of homelessness throughout their life. They are less likely to receive vaccinations. Hospitals who treat primarily minorities often receive lower quality ratings than their counterparts. And not only are these groups overlooked, they often are mistreated or not provided the same level of care as non-minority patients. These impacted groups may become subject to selective treatment in certain cases. This means that the difference between life and death may come down to something as insignificant as race, ethnicity, or social class. Some of you may wonder why this really matters. However, this issue affects more than just people of minority backgrounds. Unequal access often leads to longer waiting times for everyone in the emergency room. Emergency room doctors face even more stressful environments than they should due to the increased volume of patients whom require their attention for any medical needs, regardless of the severity. This is a result of the population who lacks insurance or the funds to pay for medical emergencies. This issue only furthers the already existent disparity that can be seen between different racial and social classes in America. I have come to the conclusion that this will not be fixed in one day. However, it is important to make the issue apparent to everyone, not just the people who are experiencing the negative effects. I have devised a number of potential methods to help guide our health system in the direction of achieving an equal opportunity for all groups. First, we must improve the health literacy and knowledge of racial minorities and lower social class citizens. One of the leading reasons for why so many individuals do not receive vaccinations is due to the misconceptions which surround these vaccinations. By improving these people's knowledge of healthcare, they can be more responsible for their own health outcomes to a certain extent. And secondly, we must focus on preventative care. By helping these people live healthy lives, they may be at less risk for developing the more serious chronic diseases which can leave them in the hospital or emergency rooms for weeks or longer. This could help improve these citizens' overall quality of life as well as relieve some of the pressure felt by busy ER staffs. And lastly, we need to make vaccinations more accessible. By eliminating the stigma surrounding vaccinations and ensuring that the majority of the population receives vaccinations, we can hope that the entire U.S. will benefit and more people can live healthy, happy lives.